My name is Jennifer, and I am here to talk to you guys today about why mental health screening should be a part of children's regular health screenings. Suicide is the third leading cause of death in children ages 10 to 15 in the United States. Based on the 2017 Youth Risk Behavior Survey, 7.4% of youth in grades 9 through 12 reported that they had made at least one suicide attempt in the past 12 months. Female students attempted almost twice as often as male students at 9.3% versus 5.1%. African American students reported the highest rate of attempts at 9.8%, with white students reported making a suicide attempt rate of approximately 6.1%. Approximately 2.4% of all students reported making a suicide attempt that required attention by either a nurse or a physician. For those requiring treatment, the rates were highest for African American students at 3.4%. In the US, there is no complete count of suicide data. The CDC only gathers that data from hospitals on non-fatal injuries, from self-harm as survey data, not death rates. So if someone dies, they don't necessarily mark it down, and that's up to the hospitals to report on their own. The statistics from the Foundation of Suicide speaks volumes. If 7% of our youth is suffering from depression and not being treated, why aren't we making more of an effort to be aware of mental health in our children? That's 7 out of every 100 kids in so much pain that they feel the need to take their own life. The fact that the CDC only gathers data on non-fatal injuries and does not commit to a complete count of data for these instances is also telling of our inattention to our youth. Statistics for younger children are even more difficult to find. But mental illness does not discriminate by age, by gender, or by race, and the need to open our eyes and take a closer look at our children is dire. While there is a strong association with suicide and child abuse, this is not the only factor in children's mental illness. A genetic predisposition has been determined, as demonstrated by multiple research studies done on people with depression, familial history, and what genes they carry. So if we know that there is a genetic predisposition to mental illness, why aren't we screening children for it regularly? As the International Archives of Medicine states, nowadays depression in adolescence is understood to be a common, disabling and recurrent disease. So if it is understood to be a common, and we understand that it is a killer, shouldn't there be regular mental health screenings for our children when they have their annual physical, as well as their normal, like, getting tested for other diseases? Like, we always test for, every time you go in, they test to see if you're anemic, if you have iron, and it takes an extra, 5 minutes to do. So if it's understood to be common, and we understand that it's a killer, then there should be a screening at every physical for children. And mental illness really should be treated like it's a regular illness, not like it's, oh, you need to get up and get over this. Because a lot of places and a lot of people treat it like it's like you're making it up, or you're doing it to manipulate people, or you need to just get over yourself. It's just as easy as picking yourself up and keeping on going. Positive mindset, honey. And it doesn't really work like that. It's an illness just like any other illness. It's chemicals in your brain, and there's nothing you can do but go to the doctor, do what you need to do, and treat it like any other disease. And this one is one that can be just as deadly as any other illness. And it has even more devastating consequences, because when your child tries to take their own life, that impacts the entire family. Because then suddenly it's not, oh, my child had cancer and died, but my child took their own life, and what have I done? Or what has happened to them, and what have I missed? What pinpoint in their life have I missed? What turning point have I missed that started this avalanche of depression? And then, it can break families up. Whenever a child attempts suicide, Children's Protective Services is called, for obvious reasons. Because they want to make sure that the child's not being abused, which is the number one reason. But then the entire family gets investigated, and you have people come into your home, and they look through your cabinets, and they talk to you, and they ask you intrusive questions. And then they have to give you a piece of paper after 60 days determining whether or not they have decided you are a good parent. So when you get that little certificate that says, yes, I am in fact a good parent, it doesn't make you feel any better. You already had these people in your home. And your whole family is just in pieces over it. And it causes fights between family members because some family members think that you're the cause of your child's problems. Other family members say, oh no, it's the child. Other family members say, well, she's just trying to manipulate you. Really, what child would do that? Kids try and get away with stuff, but no child will ever try to manipulate somebody that badly. They're going to use death as a way to get their way. If pediatricians started screening children from a young age, asking them questions similar to those on the suicide risk screening tool, which the National Institute of Mental Health has for free, so it's a free tool that doctors can use. It's not like it's going to cost them any extra. We might be able to take the 7 out of 100 children and lower it to 1 or 2. Maybe make it so unheard of that it's viewed as an anomaly, rather than another sad incident. And to that end, the United States has taken some steps. The United States has a law in place for children who are covered by Medicaid, called the Early and Periodic Screening, Diagnostic, and Treatment, which covers both mental and physical health. However, this only covers children who are covered by Medicaid. So all those other children who are covered by regular privatized health insurance don't get this screening because it's not considered a regular part of their screening. It's not a part of the law. They still could get away with not doing it. So those children aren't being asked these questions. And privatized healthcare is tricky. When you have a PPO, for instance, with an HMO, you go in, you get the referral, they assign you to somebody. But if you have a PPO, which everybody hears that PPO is the best one to have, it's what you need, you're on your own. So then you get a list of names, and you're like, I'm going to call this person and see if they take my insurance, and they don't. I'm going to give this person my number and see if they'll call me back. Oh, this person stopped taking insurance and is now cash only. This person doesn't see children. This person doesn't see children between the ages of blank and blank. This person is full, and this person only sees autistic children. So soon you realize you have a whole list of names that does you absolutely no good and nobody for your child to see. And there's no laws protecting our children in that regard. And you can't get a diagnosis of depression for your child without a mental health care provider. Because they're not going to look at you and take you seriously because they're going to say, what child is depressed? A lot of them are. And finding cost-effective care can really put a burden on families who don't have the money for that. Especially if you're in an area where where the providers are only cash only because they don't want to deal with the health insurances anymore, which a lot of providers do because they get paid less by health insurances. They don't get paid on time by health insurances, so why would they want to? And then there was a Canadian study that showed, and this is why it's so important for our kids to be seen by doctors and to talk to the doctors, not just go over the physical problems. Because a Canadian study showed that 80% of youth who died by suicide visited a primary care provider or hospital within 3 months before their death. So 3 months before these children died, they saw a doctor, which means that doctor could have been asking them questions and asking them, how are you feeling? How have you been feeling lately? Have you been a little more nervous? Have you been a little more anxious? It's just little questions like that. The doctors aren't asking our children, do you want to die? They're just asking, are you feeling anxious? Because there's a scale, and they can tell just by that scale how our child is doing. There's plenty of research behind it. So why aren't we screening our kids when they're being seen by a doctor? What is our excuse behind our woeful lack of screening and research? If we can fund research for other diseases in children, why aren't we funding research for mental illness? Why aren't we paying more attention, especially for something that seems to be such a growing problem? You hear about it more and more. You talk to kids, and they're like, oh, my friend so-and-so, or I know this person that did this, or I know somebody that cut, or I'm not surprised that my friend was in the hospital. Everybody saw that coming. And you're like, but you're 12, 13. You're just a baby still. Why are you feeling like this? And why aren't our doctors talking to our kids? That's their job. Shouldn't a physician be protecting their mind as well as their physical well-being? Isn't the mind a part of the body? And when you're a parent and they tell you, oh, your kid's just teenagering early. Oh, wow, they must be hitting puberty early. It's not that. And then you find out later that it's not. And that, no, your kid wasn't just hitting puberty early. That there was a bigger problem. But everybody wrote it off as normal adolescent rebellion. Our children are what should be most dear to us. They're our future, and one of the ways we can prevent tragedy is by using screening tools to help identify suicidal ideation in our youth. The tools are free. Screening only takes an extra few minutes, and this is the big one. It can be done in a waiting room by questionnaire on a tablet prior to seeing the physician. So when they're just sitting in the waiting room, the physician doesn't even actually have to talk to the kid. The kid just can flip through some questions on a tablet and answer them. Really simple questions. It's done like this in many mental health facilities to cut down on time so that the doctors can see more patients in a short amount of time. And then the doctor will have the data from the patient before they ever even see them, because it shows on the screen a scale of just where they are with their mood. If they're really depressed, if they're baseline, if they're maybe a little manic, just from some questions. And it's not even questions that make you think that they're asking you about death or anything like that. They're just asking, are you anxious? Are you nervous? Have you been feeling angry? Have you been feeling a little extra happy? You know, how are you? Our kids aren't going to know what they're being asked. And then no time is wasted, and only minimal effort is needed to help screen for one of the top causes of death of children in the United States. Shouldn't be number 3. It shouldn't even be number 10. Children shouldn't be dying because they're taking their own lives. And we should be putting a stop to it, and we should be making it a part of the normal healthcare screening for our children to be checked over mentally. Puberty is a really difficult time. The onset of puberty is a really difficult time. And we just aren't paying enough attention to our kids, particularly in a world that is changing so incredibly fast. I look back from when I was a child to now, so many things have changed. It's night and day. Everything's sped up so fast, and it's going even faster for our kids. Of course they're a little blown away and confused and thrown off. It's really important. It seems like with such a simple tool, we no longer have an excuse as a society and the protectors of our future generations not to implement it in order to prevent our children from mental anguish, deadly thoughts, and harmful actions. Any other killer disease is screened for on a regular basis. Any other disease. Even cancer. They even look at your freckles. So why aren't we looking at the freckles of the brain? And we should make mental illness and suicidal ideation another screen for condition. It's a simple helper to a tragic condition that no child should have to suffer through. A child should be a time of happiness and joy, not bleak, empty despair. And it's up to us to make sure that that changes. Thank you.